Hi everyone, welcome to Rethink, Your Life, Your Choice. We bring together community leaders, advocates, and residents like you to find solutions for better health where we live, work, learn, and play. I'm your host, Emily Deeringer. Thanks for being here today. Today we're sharing some of the progress being made by the Winnebago County Heroin Task Force in the battle against heroin use. We're also showcasing some of the great work our youth coalition is doing and their recent trip to Washington, D.C. to learn more about substance abuse prevention. I'd like to welcome our first guest to our show today. We have Tracy Warren, Emergency Preparedness and Trauma Coordinator with Aurora here in Oshkosh. Scott Stokes, Director of Prevention Services with the AIDS Resource Center of Wisconsin. And Heidi Keating, Public Health Planner from Winnebago County Health Department, which is a new role for her. Thanks for all you being here today.
Thank you.
Awesome. So, Tracy, can you tell me a little bit more about what you do at Aurora and how you became connected to the Heroin Task Force?
Absolutely. I've worked as an emergency department nurse for the past 16 years with Aurora Healthcare. Most recently, several of those years, I was ER supervisor. While in that role, I attended the launch of the Heroin Task Force, which is something that I still remain committed to, even though my roles have transitioned a little bit within the hospital and clinics. But over my career in the emergency department, I became very familiar with death. It's not something that's unseen in the emergency department. And to hear those cries of families in that immediate grief, mothers, fathers, children losing their parents is something that never gets easier. The task force was one way to potentially prevent some of that heartache and loss. As a mother and as a nurse, that's definitely something that's important to me. This path then led me to complete my 4-year degree at UW-Oshkosh. In order to complete my BSN degree, the final semester requires an 84-hour clinical component with a BSN nurse, which led me to seek placement within the Winnebago County Health Department. So that final semester centers on a large final project encompassing all the quality and safety competencies of a 4-year nursing graduate. I met with the leaders at the health department to brainstorm topics, what's going on in the community, what's important to them, what's important to me as a professional, and how we can kind of come up with something meaningful that's going to make a difference. And that topic really led to the necessity of a needle exchange program locally, as the previous closest exchange was Appleton, Milwaukee, Madison.
So your student project is kind of the springboard that led the health department to be ready to operate a needle exchange.
Absolutely,
awesome.
Absolutely. It's been very, very rewarding to see something that you've laid the groundwork on really come to fruition. My project really presented research and data supporting the importance of a needle exchange program, and knowing that public health nursing is shifting from just a single patient focus to more of a community focus. And heroin's just one great example of that. The fallout that we know from heroin use on the community is not just a nursing problem, it definitely is a community problem, which often falls to the health department to help orchestrate change. One of the potential solutions to help manage and control the spread of communicable disease by that IV drug user is to provide education, resources, and an outlet to get sterile supplies as well to decrease the need to reuse and share drug paraphernalia.
So it really sounds like a good match with your expertise
Absolutely.
and your experience in the ED and your personal connectedness and passion about heroin
Absolutely.
Prevention. So seeing that, it kind of really made sense for you to be matched with the health department and help spearhead,
Absolutely.
this project.
The heroin epidemic, the disease can be spread through sharing and reusing needles, syringes, equipment. Although the public health nurse may have the values that they want to completely eliminate drug use, it is a baby steps process. The overarching goal is that, but this is something that we can help control and manage, immediately. Let's put those steps in place. And really we're seeing with needle exchange programs nationally, internationally, that we're decreasing the amounts of the spread of HIV, the spread of hepatitis C, which is something that's very important in our community. Heroin users are not only at risk for the effects of drug overdosing, of course, but also, like I said, hepatitis B, hepatitis C, HIV, other bloodborne pathogens, and hepatitis C we've seen is most common in our area. One of the staggering statistics that I definitely wanted to include for you and for our viewers is a statistic by the National Harm Reduction Coalition. The research estimates up to 75% of new IV drug users will become positive for hepatitis within 6 years of beginning to inject drugs. So, 8 out of 10 are becoming infected, so that's why there is some other implications to help get this under control.
Right, and thank you so much for that overview, because I think a lot of times the general public might miss the communicable disease aspect of it.
Absolutely. So it's always a fear, I think, of the community of saying, you know, ooh, I don't know if I want that in my backyard, you know, what's that going to do? And it really, with this project and partnering with the AIDS Resource Center and the health department, getting that message out there that this is the bigger picture, that this isn't going to go away. This isn't, you know, let's get rid of some of those preconceived notions and get the facts and the data to support it. So,
great. So then let's back up a little bit. Heidi, how was a needle exchange identified as a potential solution for some of these things in the first place?
Well, it came from the harm reduction pillar from the Heroin Task Force, which we started in 2013. We were looking for evidence-based solutions, and a needle exchange program is, there's a tremendous amount of evidence behind it that it does reduce diseases. Also, it does not increase drug use. And I think, like what Tracy was saying, that people sometimes get nervous about it, but there's no evidence that it increases drug use. It also offers a place for people to dispose of needles safely. So, you know, those were really the main things. And we did look for various locations and really decided that the health department made the most sense.
I was just going to say, you took the words right out of my mouth. That sounds exactly like why the Winnebago County Health Department really sounded like a good fit for another location for needle exchange in the Fox Valley.
Yeah, I mean, there's places that, like the AIDS Resource Center, and we have one in Appleton, and then there's some mobile options, you know, but with our staff and the training that we have, it really makes sense.
Awesome. And I know both of you mentioned it's really about harm reduction. You know, and that's one of the big things for needle exchange and making sure that, you know, those communicable diseases, hepatitis C types of things aren't being spread. And this is a needle exchange is one of the ways that we can prevent that.
Absolutely. We also want, you know, drug users to feel that they can come into the health department. We want them to feel welcome. We provide them with, we have a great partnership with AIDS Resource Center that they provide us with the supplies. And then, you know, we try to really develop a relationship with the clients so they feel welcome, they feel comfortable, they'll return. We also can offer them, you know, the other services that the health department has.
So can you, so let's go over that process a little bit so our viewers kind of, you know, demystify that a little bit more. So Scott, can you tell us a little bit about kind of the process of someone going through LifePoint?
Sure. It doesn't necessarily have to be a drug user, but probably 99% of our participants are drug users. It is an anonymous program, so there is no enrollment. You don't have to sign a card saying that I'm accessing clean needle exchange services. And we know that many states it is a process where they do have to enroll, and it's a huge barrier for people getting services. There are no limits on the amounts of supplies that people can get. It's a need-based program. The goal is 1 sterile injection per use. So what materials do you need to meet that goal? And then whatever that amount of materials is that they need, we will set them up with. It really is about developing relationships. Oftentimes our needle exchange staff are the first individuals that an active drug user will come to when they need help for something because they have that relationship developed. And then it is a pathway for other services. Everybody is offered HIV testing, hepatitis C testing, and then we try to encourage them to get trained to prevent fatal opiate overdoses.
Gotcha. So I know we've got Narcan trainings in the community. That's another, you know, connection to some resources. But when people come in, there's some other resources that people might be able to get access to. Can you explain a little bit about that?
Yeah. Well, we do provide a lot of different resources. One of the big ones is the access to drug treatment. I mean, when somebody comes into the exchange for the first time, it really is just a clear-cut exchange. We don't shove a bunch of information down their throats that they don't want. They're nervous about being there for the first time, so we just do the exchange and let them be on their way. And then as time goes, they start building relationships with the staff, and every time they come in for an exchange activity, we interject more information. Are you interested in an HIV test? You know, we could do that now. Would you like a hepatitis C test? Have you ever thought about getting clean, and are you interested in some treatment services? And whatever it is they identify that they're interested in, then we go out and we help them access those services. We also realize too that oftentimes they're interested in treatment when they're experiencing a crisis. So it's really important that staff are equipped on how to help them get those services immediately when they are experiencing that crisis. Because when the crisis passes, a lot of times the opportunity for treatment might pass as well.
Right. Great. Good information. So how are things going with Winnebago County Health Department being a LifePoint site? We've been open since January.
Yeah, it's going really well. I mean, we started out, pretty slow, and I think the word is starting to spread. We're really using word of mouth among folks that use the service. So we're really pleased.
And where do people go?
They go to the Winnebago County Health Department, 112 Otter Avenue in Oshkosh, 8 a.m. to 3:30, Monday through Friday.
And that's right across the street from the downtown post offices.
Mm-hmm.
We get that question a lot. So across the street from the blue mailboxes. So thank you all for being here today so much, for sharing about LifePoint and sharing about harm reduction and the important need that this satisfies in our community, and also for dispelling a few of those myths that might be out there about needle exchange. So again, thank you very much for sharing. So.